Hello, everyone, and welcome. We're so glad that you could join for our presentation on enhancing family, school, and community partnerships for youth mental health. I'm Andy Garbacz. I'm an associate professor in the Department of Educational Psychology and co-director of the School Mental Health Collaborative at the University of Wisconsin-Madison, joined here by my colleague, Kelly Perales. And Kelly, I'll let you introduce yourself.
Hi, everyone. My name is Kelly Perales. I co-direct the Midwest PBIS network. We are a regional hub of the Center on PBIS.
Great. And as I mentioned, I co-direct the School Mental Health Collaborative, where we conduct research on school mental health. We also promote the dissemination of evidence-based practices and develop research practice partnerships with school and community agencies. Our project is specifically titled Project EPIC, or Enhancing Family, School, and Community Partnerships through an Interconnected Systems Framework. We're really pleased and grateful for funding from the U.S. Department of Education, specifically the Office of Special Education Programs, to conduct this model demonstration project of the Interconnected Systems Framework, or ISF, under real-world conditions, where we'll be working directly with school mental health professionals, educators, and other school staff in different schools across the country to help align and integrate family, school, community partnership practices within the ISF. This is a 5-year project with focus on outcomes within 4 middle schools. I mentioned across 3 states, that's in Illinois, Wisconsin, and New York. Our overall goal is to build capacity within these different districts to sustain rigorous and effective school mental health strategies that really center on the voice and experiences of families and youth. So here's a little bit more about the sites that we'll be working with. The first site in New York is a rural school district. And again, we'll be working with 1 middle school there. The second site is a suburban school district in Illinois. We'll be working with 2 middle schools there. And then finally, in Wisconsin, we'll be working in an urban school district, focusing on 1 middle school as a starting place, with the hope that we'll be able to sort of regenerate and expand this work across sites within the district. Each district has been implementing positive behavioral interventions and supports, or PBIS, to some degree, and has mental health partners who are supporting students within the district. So here's kind of a look at our logic model. You can see here that we start with some key inputs that include different activities, such as training and technical assistance, as well as resources, personnel, and materials, of course, the ISF curriculum itself, and then the tiered framework implementation support, which lead to several outputs around schools and agencies, students, families, with more proximal outcomes on student, family, and community mental health engagement, fidelity of implementation, and student social, emotional, behavioral functioning, with longer-term, more distal or lagging outcomes on student academic achievement, teacher self-efficacy, climate. And so what we're really focusing on here is examining practices, initiatives, and programs and data to promote youth mental health. Our findings will hopefully provide opportunities for further alignment, integration, and even potential elimination of ineffective practices, with the idea that we'll be working smarter and not harder. Not introducing a new initiative, but reorganizing a set of systems and practices towards greater efficiencies, and being deliberate and intentional about our partnerships to address the social emotional health of all students.
Thanks, Andy. Just to set the stage for why we feel like this work is critical, especially now, is that even before the start of the COVID-19 pandemic, there was a lot of data to tell us that there was an increase in need for social, emotional, behavioral, and mental health supports within schools. And these trends, we know, have not improved over the last 2 years. In fact, we don't yet know the impact that all of the COVID-19 pandemic and the civil unrest and social justice issues that have been rampant across our country over the past 2 years, what that impact has had on these data points. We certainly know that there has been an acknowledgement of the unprecedented magnitude of mental health needs, and that, especially while school was shut down or kids were learning in hybrid or virtual modalities, that there was an increase in things like emergency room visits related to mental health concerns for young people. Parents reporting that they were concerned about not only their child's behavior, but also increases in things like anxiety and depression. And you can see by youth self-report things like sleep loss, unhappiness or depression, feeling stressed out or strained, or losing confidence in themselves are things that young people themselves are saying. And also, schools have been noticing that some kids did not return to in-person instruction. Maybe they're learning virtually, or decided to go to private schools or cyber schools or charter schools. And so there are public education folks who are saying, we don't even know where some of our kids went these last few years. And so in the fall of this school year, the U.S. Department of Education put out a lengthy guidance document around supporting social, emotional, behavioral, and mental health needs. And if you look at the recommendations, they are very much in line with the interconnected systems framework and what we are proposing to accomplish as part of our project and our model demonstration over the course of the next 5 years. And when we're talking about an interconnected systems framework, what we really mean is how can we support the education system and community partners who are supporting mental health needs within schools to move from a co-located model where maybe a clinician has a space in a school to work with a caseload of identified students to an integrated approach where partners from the community and family members are part of the teaming structures within schools, that they're using school community data to identify need, matching best practices to address those needs, and progress monitoring student outcomes together. And so if you want more information about the interconnected systems framework, you can find it both at PBIS.org as well as our Midwest website, where you will learn about how this is a structure and a process for leaders in education and mental health systems to interact and collaborate in effective and efficient ways. It needs to be guided by key stakeholders who have decision-making authority, especially if people's roles need to change, they need to change policy or funding structures. And so the big idea is for districts and community partners to examine all of their related initiatives and practices and align them into the evidence-based multi-tiered system of support known as PBIS. There is recent literature to tell us why we should use a multi-tiered system of support to install any related initiatives or practices. And it is because this public health framework is the way in which we can get accurate, durable, and scalable implementation. It's how we can identify early those students who are at risk or who need additional layers of support. And it's all grounded in that public health model that tells us if we use our school community data at the local level, we'll be able to provide that continuum of evidence-based practices that's most likely to lead to positive impact. When looking at the core features of a multi-tiered system of support, the 6 common features here are what we utilize in our interconnected systems framework. And it comes from some early work where Kent McIntosh and Steve Goodman were examining what historically was known as a system of support on the academic side known as response to intervention, And in the early iteration of PBIS, which was about addressing behavior, when you look at those sort of common factors, those are the core features that we have iterated upon over the years and expanded in our logic of moving beyond only thinking about academics and behavior to more of the social, emotional, mental health ideas and concepts within that MTSS. We build it upon PBIS because we have 24 years of data and evidence to tell us how it improves outcomes for students and staff and reduces exclusionary discipline within schools. And some of the ways that we expand those core features is to include, again, family members and community partners on school teams, as well as district leadership teams, bringing in community data points, and we'll show you some examples here in a few minutes, having the idea of universal screening for both internalizing and externalizing social, emotional, behavioral concerns part of the system within schools, coaches who are both from education and mental health, who can support professional development that should be provided to those who are working within schools, and progress monitoring of both the fidelity of implementation of interventions across the tiers, as well as for impact and outcomes. There are some key messages within this model that I just want to touch on briefly, and that is this idea of a single system of delivery where community partners and educational experts meet together to decide how they're going to address needs within schools as part of one system. Moving beyond access, getting access to interventions is an important part of the puzzle, and we shouldn't stop there by only counting the number of kids who are working with clinicians either in small groups or individual interventions. We have to be tracking what were the presenting problems and are those getting better as a result of the interventions being provided. We need to ensure that we're paying attention to prevention and the wellness of adults within schools, meaning ensuring that they know how to take care of their own mental health, as well as providing professional development, coaching, and technical assistance so that educators feel confident and competent to address the social, emotional, behavioral needs of all students, and then using that logic and the core features of our multi-tiered system of support. So there are several things that we've already learned in prior research studies, as well as practical application in other model demonstrations of what will be different when implementing an interconnected system and why it is a better approach than a co-located model. And that is that we know when we have the perspective and perception of youth and family, hearing their voices and knowing what's important to them, what they value, what they can tell us from their lens about the current context of need is really critical in shared decision making. Having clinicians actively participate on teams from community providers, make sure that we have expertise at the table to, again, hear their perspective, learn about their expertise in their content areas, and have them help with shared problem solving and decision making. And all of that will help lead to, the effort of prevention through intensive intervention in a way that is intentional and deliberate, and so that everyone knows what is happening, what the skills are, so that there can be transference and generalization across settings. There is guidance that can be used in helping district and school teams with the work and the continuous quality improvement process. And all of that can be done through coaching and professional development. And that's what we will be doing in the 3 sites that we're going to be working with. And so our team is going to be working very closely with district community leaders in the 3 sites, as well as school teams within the middle schools to help them successfully do this work together. And so, again, although not in a linear process, we will be working with them on assessing what's currently happening with school mental health and PBIS, helping them establish routines and procedures, an evaluation plan, an action plan, and all of the work that they'll be doing together. And there's some guidance around who should be on the teams, both at the district and school level, as well as what types of things should they be focused on. And that's what we will be supporting them with over the course of time. And so you can see here who some of the people are who might be members of these teams, as well as what their roles and responsibilities will be. And again, not to say that they'll have this at the onset, but it's the way in which we'll be working together with them and their family partners as well as community partners to kind of build their teaming structures over time, as well as the shared decision-making and problem-solving that they'll be doing together. This graphic here comes from the implementation blueprint from PBIS, and it's the logic, again, that we use to get started because we have the longitudinal evidence about the way in which this model works. And so building upon it by adding family members and community partners to these teams, they'll be paying attention to both the executive functions and implementation functions of the work to support successful implementation within the model demo schools. And so whether or not these middle schools have one team that talks about all three tiers or two teams, one talking about what's happening for all kids, all staff, all areas of the school, and another that focuses on advanced tiers when it's identified that kids need additional layers of support, we're going to be working with them on the ways in which they coordinate their efforts and make shared decisions based on their local contextual data. And you'll notice here in this graphic the ways in which community partners and family members will be involved and included in the system level conversations where their voice and collaborative problem solving will be embedded into what the school teams are already doing in an enhanced way. I'm going to turn this now back to Andy, who's going to talk a little bit about the ways in which we're going to dig into enhancing the data, as well as some of the tools we're using as we get started in these three different sites.
Great, thank you, Kelly. So this slide really highlights the important role that data will have in our continual problem solving and planning over time, and particularly pointing out the importance of using school data, but also broadening those data to include different community and district data sources as well, really broadening our conceptualization of who's reporting information about student social emotional wellness and school climate, as well as what data we're using from the broader school community to inform our decision making. We're aiming to use a broader spectrum of data as we move forward in our work, aligning and integrating these initiatives in our project. The next slide provides a little bit more detail in terms of what this is already looking like for us in our project. And so here we're highlighting that we are doing, I think, a few things that will really highlight the kind of the real world nature of implementation that exists in this work. The first is that we have designed a group and individual interview protocol that we'll use with parents or caregivers, teachers, and school mental health professionals to better understand their goals and priorities, and then integrate the ideas that they suggest into our refinement of how the ISF can be implemented within the context of their schools. We're also using those data to refine a measure and a framework for family school collaboration within the ISF based on evidence-based mental health practices and right alongside the feedback that parents, educators, mental health professionals are providing to us. We're able to use that information also in the context of the ISF initiative inventory that will provide us with an overall depiction of what existing social, emotional, and behavioral initiatives or programs are available or currently being implemented in the larger community. We can take stock of their relative effectiveness, how well they're working, their relevance or feasibility, and how well they're being implemented. We can also take a look at funding and resource allocation. And then with all that information together, we can sort of begin to map out areas of redundancy that we might find that we can use to de-implement certain practices, streamline initiatives, or integrate different services to help promote youth mental and behavioral health. This process is typically led by a district community leadership team with representatives across different stakeholder groups. We can then use that information in a table such as this building level intervention mapping tool that allows us to map out across Tier 1, Tier 2, and Tier 3 different interventions that we might implement, certain expected outcomes or needs or valued outcomes that we have as a community. We can determine who will be responsible for facilitating any decision rules that we're using, student participation, progress made, et cetera. So this just allows us to sort of map out all of our different interventions to take a broader picture, provide a broader perspective of what is or may be implemented and how those different initiatives are being used over time. If you want to learn a little bit more about the ISF, you can take a look at the Interconnected Systems Framework Volume 2, an implementation guide, which is available at the link that you see here on this slide. It provides a lot of different chapters, as you can read here, 1 to 6, that provide just a really nice background for the ISF in terms of its context and structure, the defining features, things that you might consider during exploration and adoption, as well as what it might take to install the ISF at a district or community level, and then what it might look like at the building level as well, and then how you might move towards greater sustainability over time. So this is a really helpful guide to review. Keeping with this theme of new resources or other information that you might want to consider to move forward with this line of work, you can check out PBIS.org or MidwestPBIS.org, our website, the SMH Collaborative, SMHC. You can review different resources, active projects, and materials that we have available there. And then finally, here's a link to a video that will explain a little bit more about the Interconnected Systems Framework and what you can expect when really centering on and advancing mental health system integration within your schools.